Hi everybody. So I decided to create this video giving you guys a recap and review on care of the surgical patient. Okay, you have your exam coming up, and I just hope this helps. All right, recap and review for care of the surgical patient. To begin, perioperative care. Okay, perioperative care consists of 3 phases. All right, your preoperative phase, which is the very first phase. Okay, your intra-op phase, that's the second phase, and then your post-op. All right, that's the third. All right, pre-op begins as soon as the patient is informed that they need surgery. Okay, your intraoperative phase begins the moment they enter the operating room. Okay, your post-operative phase begins the moment they exit the operating room. Okay, different settings that perioperative care is involved in or can be done is your acute care hospitals, okay, surgical clinics, ambulatory clinics and centers, and surgical provider offices. Okay, so like in an outpatient setting. Okay, so I'm going to go over what your preoperative phase consists of. All right, your most important thing, okay, your first important thing is informed consent. Informed consent is necessary because the patient, that tells us that the patient consents to having this procedure. Okay, they're allowing the procedure. They have been informed of all of the risks. All right, they are knowledgeable about the type of anesthesia that will be used. We will go over that in a moment. Okay, anesthesia. So we'll put a pin there, but they have been informed that what type of anesthesia will be used, any possible procedures that could also take place during that surgery. Okay, and then also the post-op plan. Okay, they're informed of the post-op plan way before they have the surgery, during the preoperative phase. Okay, your surgeons, their role and responsibility is to obtain this consent. Okay, they are responsible for letting the patient know all that I just mentioned, the risks, why they're having the surgery, answer all of their questions. But us as the nurse, our role is to witness that it is signed. Okay, witness it being signed and make sure that it was signed. Okay, that is our role in informed consent. Okay, next in your pre-op, okay, pre-op care, surgical checklist. Okay, your surgical checklist will consist of an outline, every single thing that the patient needs to do, as well as what you need to do before that patient can enter that operating room. Okay, and everything must be documented. Okay, you are to make sure that all of the preoperative activities have been completed, and this can consist of blood work. Okay, your complete blood count, your CBC, your comprehensive metabolic panel, your CMP, okay, your clotting test, your PT, PTT, INR tests, okay, and even an EKG to check the heart, to see if the heart, to see if that patient can sustain this surgery. Okay. The checklist will also include the time that the surgery will take place, the date, when it's scheduled, where it's scheduled. Okay, and one key thing that you need to remember in the pre-op phase and through the entire perioperative period is safety. Your patient's safety is priority. Okay, so moving on. All right, so again, outlining everything for your preoperative period. Okay, prepping your client for surgery. You want to get a health history. Okay, your health history for your patient. Okay, how do they act or react? Have they had any previous reactions to anesthesia in the past? Okay, full health history. Have they had surgery prior? All right, any allergies? Okay, allergies are critical because they will need a bright red allergy band, okay, placed on their wrist. Okay, do they have any allergies? Any penicillin allergies, any allergies to iodine, to latex, so on and so on. All right, then you do your full head to toe assessment. Okay, head to toe. Okay, your full head to toe assessment. And then you get your baseline vital signs. Your baseline vital signs, also as well as your height and weight. Okay, these are key baseline vital signs, because all the vital signs that are going to be taken thereafter, they're going to be compared to that baseline, that first initial set. Okay, and then skin preparation. All right, a lot of the times for surgery, skin prep is needed. Okay, you may have to wash your entire patient in HypoCleanse. Okay, to get rid of all bacteria and microorganisms. All right, has your patient been NPO? Okay, nothing by mouth. Okay, any medication administration? Are they required prophylactic antibiotics before they go into surgery to prevent any infection after? Okay, did they stop taking any of their blood thinners a week prior? Okay, so medication administration. Remove all of the items prior to having the surgery. Okay, any jewelry, dentures, hearing aids, okay, makeup, nail polish, glasses, contacts, everything, artificial limbs, even everything needs to be removed before your client has surgery. Okay, and then lastly, psychological support. Provide that psychological support for your patients. Okay, a lot of us as human, we fear the unexpected. Okay, we fear the unexpected because we don't know what's going to happen. All right, I know me personally, if I was to have surgery, I've never had to have surgery, but if I was, I would be terrified. So you as their nurse, you provide that psychological support for them. Okay, you be there for them. Okay, they're gonna feel anxious. Okay, if they need medications for that, then you contact the surgeon. Right, they may feel anxious having to be put under. Okay, all right, so next, I do want to touch on for your preoperative care, a couple of age-related risks. Some comorbidities for our older adult patients. All right, they could have comorbidities and pre-existing factors that can contribute to delayed wound healing or impaired cognitive function, to where they won't understand like the teachings and everything that you're giving them. Okay, so you want to take that into account. All right, your older adult patients are at greater risk for complications. Okay, just because of their age. All right. Next topic. I want to go into further your diagnostic screenings and exams. So I mentioned your CBC, and what that consists of is everything blood. Okay, your hemoglobin, your hematocrit levels, your platelets. All right, even your white blood cell count. Okay, everything blood. Your CMP, that is your electrolyte panels. That's your liver and kidney function. Okay, PT, PTT, INR, these are clotting. Can your blood clot? Okay, or will it clot too fast? Okay, that's also bad. We don't want your blood to clot too fast. We want it just right. Okay, especially going into surgery. All right, for our female clients, our female patients, pregnancy tests. Okay, we want to know, are you pregnant? Okay, because your baby, or you may not be far along enough to be able to sustain this surgery, or sustain the pregnancy through this surgery. Okay, so there are other things that we need to consider. We may need to consider for our pregnant patients. So getting that pregnancy test beforehand, okay, is also critical. A urinalysis, a possible chest X-ray. Okay, type and cross match. All right, type and cross match to see your blood type, see the patient's blood type. This is important as well. Anything can happen in surgery, anything. So in the event of blood loss, the blood will need to be replenished. So they want to know your blood type. Okay, you need to know your patient's blood type to make sure that you have blood on hand and ready in the event of severe blood loss, okay, during the procedure. Okay, that is your preoperative phase. All right. Now, let's get into your intra-op. Okay, intra-op is during surgery. Your intraoperative phase begins the moment your patient hits that operating room. Okay, and it ends the moment your patient leaves the operating room and is transferred to the PACU, the post-anesthesia care unit. Okay, the type of nursing care that could be provided during intra-op in that surgical room or operating room is you can become a surgical nurse or a circulating nurse. Okay. But what you need to know, if you are in there, what anesthesia is being used, what types. Again, we will go over the types in just a moment. But what types of anesthesia are being used? Okay. Is your patient in the proper position for the surgery? Okay. You will also help the physician, the surgeon, and the anesthesiologist with whatever they need help with. Okay. If they ask you, hey, can you pass me this, or can you do this? You will do it. Okay. You will also be documenting everything that is going on during that surgery. You will maintain the sterile environment and the sterile field. Okay. And you will monitor and watch for any complications. All right. You will also be providing physiological care during that moment as well, because you want to be sure that your patient before they go under anesthesia, you want to make sure that they have a peace of mind. How they go under is how they wake up. Okay. So now let's go over your different types of sedation. Okay. Your different types. You have minimal sedation. Okay, this is where you can respond to verbal commands. So if I say, hey, blink your eyes, they will blink. Okay, they will blink their eyes. Minimal sedation. They are also breathing on their own. It's just their cognition that's off a little bit. It's impaired a little bit. Okay, then you have moderate sedation. This is a little deeper. Okay, and they can maintain their own airway still. Okay, they can still breathe on their own. All right, but they're deeper. They're in a deeper sedation than minimal. All right. Then you have deep sedation. Deep sedation, this is your general anesthesia. Okay. They cannot be awakened easily. Okay. The anesthesiologist is going to have to cut off everything and promote them to wake up. Okay. Deep sedation, general anesthesia, they are completely knocked out. Completely. All right. Completely knocked out. They are on machines to help breathe for them. And their CNS, their central nervous system, is completely suppressed. All right. Everything. So they're breathing. They have a machine that's breathing for them, and all of their senses, everything is suppressed. All right, that is your deep sedation. Okay. Next, we'll get into the post-op phase. Okay. So your post-op phase begins the moment your patient leaves that operating room and enters that PACU. Okay. Again, PACU is post-anesthesia care unit. All right. And your focus as your patient's nurse is safety, 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 safety. Of course, your ABCs, airway, breathing, circulation, a patent airway is your priority. All right. And safety. Okay. The moment you get them out of that operating room, vital signs. Okay. Vital signs. You will repeat your vital signs frequently. Okay. To make sure that your patient is stable. Make sure they're stable, okay? And the moment they wake up, then you assess their pain, right? Your patients have just been cut open, all right? They will be in pain, especially when the anesthesia start wearing off, okay? Pain assessment. Next, you guys, you want to monitor your nausea and vomiting, okay? General anesthesia, one of the main side effects is your nausea and vomiting, okay? So nausea and vomiting, and a lot of the common medications that is used for that post-op are your Reglan and your Zofran. Okay, Reglan, Zofran. These are your antiemetics that are going to be used. You also want to hand them an emesis bag. All right, for their nausea and their vomiting. Okay, you want to continue the education that you've provided to them during the pre-op phase. So in the pre-op phase, you told them what to expect. You gave them their discharge teaching. You gave them their signs of infection to look for. But now in post-op period, you're going to reiterate all of that. Okay, you're going to go back through everything and reiterate using your teach back methods. Okay, and reiterate that information to them as well as their caregiver. Okay, whoever is taking care of them after their surgery, you want to let them know as well so that they can help them with all of the instructions. Okay. Your education, your patient education is critical. Okay, you don't want your patient developing infections and all of this and not following up and being non-compliant. Okay, this can delay their care, delay their healing. Okay, delay their wound healing. Okay, you're going to explain special equipment that can potentially be used. One of them is your incentive spirometer. You're going to instruct them on how to use one of those. Okay, take a deep breath in. Okay, you're going to watch for that little ball. Watch for that little ball. Okay, any medications, post-op medications, when to continue taking medications if they were previously on any. All right, their breathing exercises, how to cough and deep breathe. All right, the importance of changing position. All right, if they need to move and change positions, okay, get that circulation going. All right, moving around the muscles and everything that's been just laying there for who God knows how long in those hours of surgery. All right, and also special considerations related to the type of surgery. Okay, so different surgeries are going to be different things, different instructions. Okay, so if there's any special instructions that you need to inform them of, then you will do so. Okay. So, again, post-op, reinforce your education. All right, give them their discharge instructions. If they need to follow up with their primary after, you let them know when. Okay, if they need to continue taking, okay, now you can start taking your blood pressure medication. You let them know that as well. Okay, nutrition intake, your proteins. Okay, that's critical for wound healing. All right, nutrition. All right, medication regimen, continuing medications, as I stated, lifestyle modifications. So if they can't lift more than 10 pounds for 2 weeks, then you need to let them know that. Okay. Wound care and dressing changes. Hey, I need you to change this bandage every 24 hours. All right. Wound care, dressing changes, as well as follow-up care, as I mentioned. Okay. That's the bulk of your recap for the surgical patient. A couple of things that I do want to highlight. As well is your types of surgeries and why. Know the different types. Okay, so a diagnostic surgery is to diagnose. An ablative surgery would be to cut off a limb or a body part. Okay, your elective surgery is your cosmetic surgery. They're electing to have it. They don't need it for any healthcare reason or any health need, but they want it. Okay. They want that surgery. And then you're reporting. Okay, so we talked about the different phases of surgery, right? Your pre-op phase, your post-op phase, your intra phase in the center. Okay, there are certain handoff reporting tools that you need to utilize when the patient is leaving from one area going to the next. Okay, you as a nurse, you're not going to go with them. You're not going to be with them in the pre-op and in the intra-op in the surgical, being the circulating and scrub nurse as well, and going and following them to the PACU and then to the post-op. You're not going to do that. So you need to be able to pass the baton. Okay, the baton is the patient. Pass them off to the next healthcare professional. Okay, the next nurse. All right, and you use an SBAR to do so. SBAR, situation, why are they here? All right, your background, what brought the client to this point. All right, the assessment. Okay, assessing your patient. What assessment? What did you find? All right, what's in the plan of care? Or was there any change? All right, anything that can be identified that can contribute to the change or the plan of the care. All right, and then your recommendation. Okay, so your goals. Share your goals that you had for your patient while they were in your care. Okay, let them know what recommendations can you give for them to continue. Okay, you use SBAR reporting for handing the patient off to the next nurse, okay, or the next healthcare professional. All right. So, with all that being said, I have a couple of questions that I'd like for you guys just to have in your mind and to think about, okay, while you guys are studying this. All right. If you have a client that was admitted to the surgical unit following a repair of the right femur fracture. Okay, right femur fracture. All right, and they're having surgery to repair that. Which of the following assessments is a priority in the post-op period? Okay, which is a priority? Priority, when you get a priority question, that means all of the answer choices are correct usually. Okay, that means they're all probably correct. But which one am I going to do first? Which one is life or death? Which is going to be more important to my patient, okay? I'm going to make a difference. I'm going to make a change, all right? Here are your answer choices. Presence of a significant other. Operative leg skin color. Last bowel movement. And dietary restrictions. Okay, I'll give you a couple minutes. Okay, time's up. If you chose operative leg skin color, then you chose correctly. Okay, you want to always remember to use your nursing judgment. Okay, use your nursing judgment and use the nursing process. Okay, your nursing process, your ADPI. Okay, all right, or your AAPI. All right, whichever one you want to use. ADPI, assessment, diagnose, plan, implementation, and evaluation. All right. Your AAPI is the exact same, but that second A is analyze. All right, we don't diagnose, but so hopefully this helps you all. Happy studying, okay, and good luck on your test.